and welcome to this session of the Joint Standing Committee on Health and Human Resources. We will be, Health and Human Services will be considering some budget items, that one of which was tabled the last time we considered the budget, and the others as people want to make amendments to the budget as we go along. We'll also be trying to find some time to prioritize our sense from HH, the whole committee, about what budgets we want to prioritize for AFA, as we have a number where we were unanimous or close and might want to encourage AFA to fund. So that's what we'll be doing this afternoon. There's one item on the table, but before we get to taking that off the table, I'll have everybody introduce themselves, starting with Representative Zager.
Thank you, Mr. Chair. Good afternoon, everyone. I'm Sam Zager. I'm honored to represent District 41, which is off Peninsula in Portland.
Representative Lemlin.
Good afternoon, everyone. My name is Michael Lemlin. I represent House District 88, Chelsea, Jefferson, Whitefield, and half of Noblesboro.
Thank you. Representative Stover.
Good afternoon. My name is Holly Stover. I represent House District 89, including the towns of Boothbay Harbor, South Port Edgecombe, West Port Island, and part of South Bristol.
Senator Baldacci, welcome.
Good afternoon. I'm Joe Baldacci. I represent Senate District 9, which is the city of Bangor and the town of Herman. Thank you.
Representative Perry.
Good afternoon. I'm Ann Perry. I represent House District 140, which includes the communities of Indian Township, Baileyville, Barron, Calais, Charlotte, Robbinston, Perry, Pembroke, and Pleasant Point.
Representative Griffin.
Good afternoon, everyone. My name is Abigail Griffin. I represent House District 102, which is Glenburn, Levant, and Duskegg.
Thank you. Representative Craven.
Thank you, Mr. Chair. Good afternoon. I'm Margaret Craven, and I represent House District 59, which is part of Lewiston.
Representative Madigan.
Good afternoon. I'm Colleen Madigan. I represent House District 110, which is part of Waterville and part of Oakland.
Representative Javner.
Good morning. I'm Representative Kathy Javner. I represent House District 141, which is located in Penobscot and Washington counties.
Senator Moore.
Good afternoon. I'm Mary Ann Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Winter Harbor, and Sullivan and Hancock County as well.
Thank you. Representative Meyer.
Thank you, Mr. Chair. I'm Representative Michelle Meyer, serving Southern Maine's House District 2, which is all of Elliott, where I live, and parts of Kittery and South Berwick.
And I'm Ned Claxton, honored to represent the folks in Senate District 20, which consists of Auburn, Minot, Mechanic Falls, Poland, and New Gloucester. We are here with our staff helping us do this work, and I see that Anna is here.
Hi, I'm Anna Broom. I'm one of the two legislative analysts for this committee, and I work in the Nonpartisan Office of Policy and Legal Analysis.
And Sam Sennett.
I'm Sam Sennett. I'm the other OPLA analyst for the committee.
Luke, want to introduce yourself?
Good afternoon. I'm Luke Lazor. I am a senior analyst in the Office of Fiscal and Program Review.
And Karen.
And I'm Karen Thomas. I'm the clerk for the HHS committee. Should you need any assistance, please email me at hhs@legislature.maine.gov.
Very good. So at this point, on the green sheet, we had an item that had been tabled. So does anybody remember what line that was? I have forgotten.
It is line 145 is where it starts, Senator.
I knew Luke could come through for us.
Would you like me to bring it up on screen?
Sure.
Okay. So Senator Claxton, do you want me to make the motion to bring it off the table?
If you would, Senator.
All right, I will make that motion, sir.
Second.
And there's a second for Representative Craven. Thank you very much. Okay, so this is on page 28 of 41, and this is line 145 to 152. So we had tabled this pending some additional information from the department to help us understand exactly where we were in this process, in this work. So, yes, Senator Baldacci?
Mr. Chairman, I just want to make sure that you have my amendment for lines 148, 152.
I don't, but we can get that. If you did you give it to Anna? And we're considering 145 through 152.
Okay, yeah. So I have an amendment to offer on that section.
Okay.
Just so that you know that, and I will send a copy of it to Anna right now. I assumed you had already gotten a copy.
Anna, do you have a copy of that amendment?
No, I don't.
Okay. So while Senator Baldacci gets that to you, Representative Zager, did you have your hand up?
Yes, sir, I did. Thank you, Senator. I was in the last several days, the department put together or floated circulated a one-pager regarding the Section 21 rate increase. And I was wondering if we could perhaps have them, I think Molly's probably in the room, speak to that, walk us through that, because I think it addresses some of the issues in line 145.
Thank you. So we'd invite Molly to introduce yourself. Good afternoon.
Good afternoon. I am Molly Bogart, Director of Government Relations from the Department of Health and Human Services, and Deputy Commissioner Mann, as well as Director Probert, are in the attendees list and hopefully going to help me out here. So if we could move them in, I'm happy to get going. And I wonder if it would be helpful for us to share the memo on the screen that we sent around this morning.
If you would, that'd be good.
No problem. Right. Right.
While we wait for that to come up, I'll let Deputy Director Mann introduce himself.
Good afternoon, everyone. My name is Benjamin Mann. I'm the Deputy Commissioner of Finance at the Department of Health and Human Services.
Thank you. And Director Probert, do you want to introduce yourself? We're not hearing you, Director. If you wanted to, you made it through the wormhole. Do you want to introduce yourself?
I heard nothing, so sorry to appear to be ignoring you. Good afternoon, Senator Claxton, Representative Meyer, and honorable members of the committee. My name is Michelle Probert, Main Care Director. Thank you for promoting me to panelist this afternoon.
Thank you for our help with our budget work. So we'll go back to you, Molly.
Great. And I'll toss it right back to Michelle in a moment. The question that we received at the last work session from, I believe, Representative Craven, but shared by other members of the committee, was whether or not we could outline the methodology for the Section 21 agency home support rates, as well as the methodologies for the two increases that have happened within the last 6 months or so, 8-9 months now. And so, Michelle, if you wouldn't mind kicking us off with that, I'll share the table that goes along with that.
Absolutely. Thanks, Molly. So just to orient folks, this is by design a simplified view to kind of explain changes to the different components and assumptions of these rates over time. The middle column with 7/1/21, those are the rates that are currently in effect for agency home supports. The column to the left are the previous rates that were in effect. And then the column on the right with 1/1/22, this is a description, assuming passage of the supplemental, of what would be forthcoming in order to fully meet the intent of Part Quadruple A of the budget. So first, I will share that we had received some questions and given some answers regarding what rate components or cost components are. Generally speaking, when you're building a rate from scratch, you kind of take a model budget sort of approach. And that includes looking at different categories of costs that are applicable to a service. Also looking at how those costs relate to one another, and looking at how much of a service is provided so that you can come up with a unit cost. A unit can be an hour, it can be a day, it depends on the service. But that is a very high level description just of how rates are built, generally speaking. So the rate for agency home supports that was in effect prior to the most recent change that went into effect this past July was based on a rate study that was conducted in 2007. Since that rate study, there have been a number of percentage increases per different legislative efforts. When that rate was adjusted over time, there was no specification in terms of that percentage increase should go towards wages or that percentage increase should go towards administrative expenses. It was just a generic percent increase. And so it's hard to precisely say what that meant for different cost components because it was just, there was a model and then it was just adjusted a number of times over the years. So first the first component, which gets into how you determine the hourly rate, is how many hours of service do members receive per week. In I'll say the old model, it was based on hours from 2007 data. For this last July, we updated that, looking at that time, the most recent utilization data that was available, which was from 2020. And we looked at the median for members and continued that same assumption about hours of service for the rates that would go into effect this past January 1. Next, we look at hourly wage and benefits for direct staff. It is most common when looking at any service that this is the biggest cost driver for rates, which is not surprising because these are the folks who are actually delivering the service. And so again, in the older rate model, this was a study conducted in 2007. And so the data that informed the original wage data was from 2007. That rate was adjusted a number of times over the years. For this past July, we looked at 2021 minimum wage and based on available resources, ended up with a benchmark wage for that labor component of 118% of 2021 minimum wage. And then again, for the rate that would go into effect for this past January, assuming passage of the supplemental, per Part Quadruple A, the wage amount is 125% of the 2022 minimum wage. So that is how that component has changed over time. And then lastly, a look at program support costs. I will note that a change in how the model was built this past July is that starting in July, an administrative percentage was included in the older study that was just lumped together under program support costs. From my own personal experience, I will say that it is most common to have an administrative percentage as we do in the current model. So looking at program support costs, again, the previous rate model that was in effect based the amount of program support costs off 2007 data, which was then adjusted as part of the overall rate over time. Starting this past July, in order to inform the amount dedicated to the program support rate component in the model, we used 2015 data, which was data from the most recent rate study that had been conducted but not implemented. The administrative percent, we did not go with the percentage that came out of that 2015 study because we had done a number of rate studies for other HCBS services around the same time. And while the previous study had looked at about a 10% administrative percent, more recent rate studies indicated that that percentage has increased. And so we increased that to 15%, which was, again, consistent with other studies from the recent past that were implemented in 2019 and 2020. And then those same assumptions from July are what are also in the January 2022 rates, except those are also adjusted for a cost of living adjustment.
Before we leave that page, are there any questions that the committee wants to ask at this high-level view? Senator Baldacci, did I see your hand go up?
I was just wondering at some point if we could have Laura Cordes come in after we get this report from the department, just to give us, the outside agency's view of things.
Sure.
Thanks.
Not any other hands up? It's hard for me to see everybody. Representative Perry, did you have your hand up?
I did. I just have a couple of questions. You had mentioned, I think, 2 different studies, one in 2007 and another one that was later, like 2015 or something along that line. How were both of those used in that calculation?
So the 2007 study was not used in our calculation of the rates for either this past July or for January. It would not be best practice by the department to look at a study that was from 2007, because in the industry, it's just considered that rate studies should be updated at least every 5 years. And so we would not look at a 2007 study to inform current rates. And then Representative Perry, in terms of it was 2015, 2016 rate study, the data was from 2015. That study was really used, as is shown on this chart, to inform the program support costs. The other elements or components of that study were updated using more recent data.
Were you aware that that study actually was not endorsed by the legislature?
I was aware that the study was not implemented. Because of that fact, we very closely went through the public comment that had been provided for that rate study. It seemed that the concerns were not actually about the rate itself, but about other changes that were going to accompany the rate. The one piece of concern regarding the rate itself from that rate study after the review of the public comment was regarding the assumed number of hours per week. So this first row that we have here. And because of that concern, we did not use the assumption about number of hours from that older study. We used current utilization so that would not be an issue.
Senator Baldacci?
Yeah, my understanding was, I think like Representative Perry's, is that this was from a study that had been rejected kind of uniformly by the legislature. But my question really is that we had these discussions. Let me just tell you where my viewpoint is, and then you can share with me yours. But we had these discussions about the dire need for wage increases back in the spring of 2021. We had heard from the providers. We had heard from the people affected. And then after we had approved a pretty significant increase, then apparently this methodology was changed, which suggests that we voted for apples and we got oranges, and which means we're not delivering, that somewhere along the line, we are not delivering as a state on the promises and the commitments that we made very publicly and very persuasively across the state that these increases were going to come. So I think that presents a problem for me as a legislator to just to follow along a methodology which was done after we had voted and made a commitment, and then seems to undermine that commitment. But that's my viewpoint. I'm happy to listen to your viewpoint on the whole thing.
Director Probert, can you speak to when the model was renovated, rehashed, redeveloped?
Certainly. So I agree with Senator Baldacci in that we were absolutely hearing concerns about the ability of the rate that we were paying to cover minimum wage. We were hearing those concerns early on in the pandemic. In response to those concerns, it was actually in late summer of 2020 that we began working on an updated rate to put forward in the budget initiative that went live in January of 2021 to implement rate adjustments for July 2021. So we had developed the model that you saw in the middle column of that chart that I was just talking through in late summer of 2020. So it was, I just had that timeline correction. We heard the urgency from providers. We wanted to make sure the rate was adequate to adjust minimum wage. We had a short timeline in order to figure out how to do that. And so we looked at the most recent data that we had available in order to make rate changes that were responsive to those provider concerns.
Thank you. Representative Madigan?
Thank you, Mr. Chair. Thank you for being here today, Ms. Probert. I guess I'm sort of confused and want to echo a little bit with what Senator Baldacci had said. You know, we had been hearing, you know, as had the department, about the need for a rate change because the rate wasn't paying enough to even pay minimum wage, let alone, you know, the increase that was needed to attract direct care workers. But I'm unsure why using a methodology that then underestimated or decreased what you calculated for administrative costs was used, considering there was so many concerns about the flaws in that methodology in the past. I know you said you read the public comments. I'm wondering, did those include the comments in legislative hearings and briefings about that?
So the comments I was referring to were the comments specific to the rate methodology and the sessions that were held around the rate methodology regarding those. So I did not see comments from the public hearing. I will say again that back when we were developing this rate methodology, we hadn't heard of LD 1573. Nobody was speaking to the department about 125% of minimum wage. So again, we looked at the most updated data that we had available and developed a rate that was intended to be responsive. It was not until late spring or early summer of 2021 that we knew that there was a connection to LD 1573. And again, we believe that it is best practice to look at the most recent data available to determine what the different cost components are for a rate model. And that is what we intended to do.
Thank you.
Representative Craven?
Thank you very much, Mr. Chair. And I do want to thank the department for all of the work that I know that they've put into this, but I'm feeling extremely frustrated. There seems to be this disconnect between the department and providers, and we are inundated with information and requests from providers and from constituents and others. And, you know, the frustration, I think, for me is that that the providers don't feel heard. For one thing, you know, they're telling me that the new methodology, you know, has cost them 40% of their, you know, of their applied program expenses. And then 30 group homes have closed for the lack of staffing. And so, as a legislator and somebody that sits on this committee, I don't even know where to go with this. And so I suppose my question is, when do you think that providers actually get enough reimbursement to sustain their programs? That's the first one. And also, can there be some room for the department to hear what providers have to say and need, because they really provide services to our very most vulnerable populations.
I can take that, I think, because I do think it is important to note the amount of funding that, if enacted, the supplemental budget, in addition to the biennial budget, would be providing to Section 21 providers overall. It would be in excess of $115 million in ongoing baseline rate increases for fiscal 22 and fiscal 23. And that's separate and distinct from the $57 million in one-time bonus payments for recruitment and retention to help stabilize the industry, in particular as part of Section 9817 home and community-based services as passed in the American Rescue Plan. So, and what we're proposing what the administration is proposing in the supplemental budget is a three times increase of what was passed by the legislature in the biennial budget. What was passed for the COLA and the 125% provision in the biennial budget was $15.6 million. The administration is proposing to increase that on top of the $15 million by $46.4 million to accelerate the COLA, to increase the COLA from 2.3% to 4.9%, and to fully fund the 125% provision that was passed in Part Quadruple A.
Can we go back to the grid that was shown earlier, and I need to stay a higher level for just a minute before we get into the weeds. Can we put that memo back up again?
Sure.
I didn't know who was steering, so I didn't know who to ask.
I can do that. Here we go.
So Director Probert, could you just comment, again, understanding we're talking about at a high level, if we go up to show that grid above changes with the biennial budget, can we go?
Yes, it's giving me a hard time. Here we go.
I don't know if you know, there we go.
There we go. Okay. So Director Probert, can you speak to the changes on hours per member per week between the first and the second and the third, understanding that we're talking about an aggregated number? Can you tell me what the changes were across that line?
Sure. So I don't have the specific hour numbers in front of me right now. I can get those if you like, but qualitatively, I can say that the old hours per member per week were from the 2007 study. I did note in one of my responses I just gave that in the 2015 study, there were concerns around the assumption about number of hours per week. Yep. Because of those concerns, we did not use the information regarding hours per service from that more recent rate study. We threw that out essentially and instead looked at the most recent data that we had available for number of hours of service, which was 2020 data.
Okay, so at a qualitative level, though, let me ask it a different way. Did the median hours of service provided per member go up for 7.1 and up for 1.1?
I will actually, Senator, need to get back to you.
Okay.
I'm not certain if we actually, again, the initial rate study was from 2007. Our records are not always fantastic going back that rates. So I need to see if we have that 2007 number of hours, and then I can answer that. But I'll see if I can do that during this session.
And it wouldn't have to be 2007 because you said that, okay, that was the basic assumption. Okay. And on the next line where it says direct wages, do you have any idea where any of the salaries between 2007 and 2021 fit compared to minimum wage? Because
So
go ahead.
I was just going to say that there was no rate study conducted during that time, and the percentage increases that were applied during that time period were not directed. The legislation did not specify that those increases should be applied to one component more than another component.
Okay. And then a question was asked about the administrative percentage, and I'm not sure I exactly understood the question, but there wasn't such a thing until the 7-1 rate was put in place, because you carved that out of what had been the program costs up until that point.
My understanding of looking at the old rate methodology is that administrative would be combined with program supports, and in the newer rate model, they were looked at as two separate components.
Yeah. So what I was trying to get at is it, if the hours per member went down, if we were already at 120% of minimum wage, and if the program costs were cut, it's conceivable that the rate could have come down with the recalculation.
The overall rate absolutely did not go down.
Right.
I do think, I think that this is an important time to offer just a quick summary. I think it's very important to recognize that on net, not a single rate under Section 21 decreased. In fact, most of them received a precipitous increase up to, I believe, 18%, and will be higher than that if the supplemental budget is passed starting in January 23. I also want to touch one more time on the rate study in 2015. I mean, I was working in the legislature at that time and remember all of the conversation and concern about that rate study. It's important to recognize, though, that the Office of Main Care Services used portions and data of that study to implement a new rate methodology. They did not take that rate recommendation from Burns whole cloth and implement it. A number of them were adjusted to address concerns that we heard at the time and in the interim from providers. And so we are not implementing a rate that was recommended in 2015. We're using data that is 8 years newer than the previous data to inform a rate that has been further adjusted to account for current circumstances.
Okay, thank you. Senator Representative Zager, did you have a question?
Thank you, Mr. Chair. Yes. Thank you, Deputy Commissioner Mann, for walking us through those what just came out in this memorandum with that tripling. Is that baseline changes? Is that the baseline budget?
Yes. So the baseline increase in fiscal 22 for Section 21 providers will go up by $43 million, nearly 44. And in fiscal 23, it will increase by $71 million baseline ongoing funding. So that will be added to what was in place previously and carried forward into the future.
Okay, thank you.
Do you want to keep going through the memo here then? Some of
Sure.
which we've already hit.
Yeah, I think if that would be helpful for you, I'm happy to.
Sure. Representative Perry?
Yeah, I just have a question about when you looked at the administrative costs, what were the factors that you put into that? Especially for those who are housing 24 hours individuals that require highly trained staff, is a piece of that not only included in this as the requirements for staff training and updating education of the staff?
So I can say that the rate study that was conducted in 2015 utilizes a provider survey to collect data. The providers are the ones who are providing the information regarding what their costs are, what the different kind of costs are, and what those cost amounts are. And I routinely hear discussion about staff training as absolutely being an important part of those costs. But it is not that the rate study administrator or vendor doesn't say, tell me about these particular kinds of costs under program supports. It's really a conversation and activity to get information from providers in terms of what are your costs for program support, generally speaking, and that information is what informs the rate model.
Does that help, Representative Perry?
Sort of.
Okay. Do you want to keep going then, Molly?
Sure. And I'm not sure Ben or Michelle who would like to walk through the next section.
I covered the funding aspects of it. Just to reiterate quickly, Section 21 providers would be receiving about $115 million in fiscal 22 and fiscal 23, above what was in place in fiscal 21. That includes a rate increase that's already in effect for fiscal 22. And then we would be tripling the amount that was appropriated in the biennial budget for the COLA and the 125% provision. The biennial budget was insufficient to fully fund 125% provision, and we are the request before you in line 145 and the subsequent lines would fully fund that to 125% of the minimum wage that was in place as of January 1, 2022.
So then the other question becomes, when some of these changes go into effect, is that on a spreadsheet down further?
The effective dates are actually
Right there. Okay.
Yep.
So anything we pass now is retroactive. If we pass the supplemental.
It would be effective back to January 1 of 2022.
Yes, thank you. Okay, are there additional questions about the memo itself? Representative Perry, your hand up again?
Yeah, sorry, I'm still sorting out. Okay, the information I received is that the administrative allowance in terms of the rate was decreased as to what it had been, and that the rest of the increase was related to salaries and personnel. So my question is that the case?
I will say that the updated data indicated that a greater percentage of costs go to staff salary and wages and fringe versus program costs. That is what the updated provider data indicated.
I guess you didn't quite answer my question in terms of what was allotted to administrative in the past.
Representative Perry, are you referring to administrative and program in one category or administrative?
No, the thing that I'm trying to sort out is the where administrative, and this is what we're hearing, is that what they're allowed for administrative in the rate has been decreased. And what I'm asking is, did that happen?
So you're asking if the administrative rate decreased between 721 and 122? Because those are the only administrative rates we have.
Yes.
Okay.
So no rates decreased. And we don't, when rates are made up of a number of components, you've said, what are they allowed to spend on administrative rates? And I want to be very clear, we cannot determine that. So the components we use as updated data as we can to inform what each component it reflects. And providers receive that top line rate, and they are able to use that rate to fund their services and programs how they see fit. And as Michelle noted, the balance of the updated data demonstrated that the balance of costs was more heavily weighted toward salaries and benefits. And that's what this updated rate reflects.
Yeah, Representative Perry, did you have something else? I can't hear you.
I got lost in the shuffle here.
There you go.
I guess the question I'm asking is, we're saying that, you know, we're getting information that says something has been decreased. And I now just got something saying that what they're talking about is program costs. And in terms of, I am trying to understand where the disagreement is and where the sense of decrease is and what that is. Even though you say the rate is, they get a rate and they can spend it the way they want, that's not necessarily the case. Those rates have components in them that really, they are required, whether you think so or not, or in essence, because if they're not using the money we're sending the salary, then that is a breach. Are we, you know, so I'm trying to understand where the difference is, what it is, has there been a decrease, and where that decrease is. And whether it program costs or administrative or, you know, I just want to know.
There has not been any rate decrease for any code. There has not been as large an increase as the providers would like.
We just have one set of providers that are looking at this. That's really why I'm trying to understand this.
So I saw some head shaking, and I'll give Molly and Director Probert a chance to respond to one of the presumptions that was just voiced.
Yeah, I mean, the rate components tell us how much we should estimate each section, each component of the service is going to cost. But that does not require providers to spend that money on those components. Those are two different things.
I guess the question I'm asking, however, is if a component has decreased and yet that spending still needs to go on, then I'm really trying to understand, with increases, with a commitment to raise salaries, which is what has had to happen, is that how we're ending up with a decrease in a program component that needs to go on as well. And that's what I'm trying to understand.
Yeah, and I fully appreciate that. Our rate is based on provider data. And so we use that provider data to inform what their actual costs have been in the past, to inform what those rate components are.
I understand that, but there's still an issue.
I'll just reiterate what Deputy Commissioner Mann said, which is that there have been no rate decreases. The rate has increased substantially. There is no requirement that providers have to spend certain components on certain costs. The problem is that there was an assumption that the rate increase was going to be higher than what it ended up being. And I think that that is the source of the issues about which we are all hearing. And again, it is bad practice to base assumptions about costs on data that is 15 years old. And so the department looked at the most recent data available for all of those cost components, and that is what these rates reflect.
Representative Perry, did you have, okay. Senator Baldacci?
Chairman,
Not here, yeah.
can you hear? Okay.
Yes.
I mean, I appreciate the department's point about being 15 years old, but the legislature has, in those 15 years since, added on to that edifice, if you will. So the whole series of assumptions that we walked into in the spring of 2021 were not just the rate study, but what had been added on by the legislature in the interim. But having said that, I would just ask if Laura Cordes could be brought in to the discussion so she could at least provide a contrasting viewpoint from her professional perspective.
Sure, we can do that. And Director Probert, I heard you say that the work on the methodology really was started in the summer of 2020. Is that what I heard? Okay,
That is correct.
thank you. Welcome, Laura Cordes.
Good afternoon, Senator.
At some point, we saw a spreadsheet in a conversation with Luke not so long ago that I would ask him or Molly to bring up, but let's hear from Laura Cordes first.
Thank you. I've been listening to the discussion. I do not have a copy of what has been shared with you today, but I will take a step back and say our concerns as providers of Section 21 agency home support is around really one question: is the increase that is scheduled for January 1, 2022, what was intended when the legislature lifted up all direct care workers with the intent of supporting a rate with 125% of minimum wage? We came before this committee and the legislature, both in the 129th with LD 2109, and again with 1573, raising the concern that this particular rate had a wage component of $11.22. That meant that the labor cost, and what we knew is that we'd been working with a rate model for 14 years. And as of June of last year, we had, with the passage of 1573 in the budget, began to look at how we could get, and we knew it was going to be certainly an expense, but one long overdue, to move below $1 of minimum wage to get to 125% of minimum wage, now at $15.94. We appreciated the department's addition last July of about $1.56 to that rate, the entire rate. Imagine that maybe that 1122 was now with $1.56 and 1270. So we were extremely surprised to find that after 14 years with one rate methodology and already planning to give increases to get to more of a competitive wage as we all intended, that the department, without any stakeholder input, a new rate study, any transparency that we would come to expect when changing a rate model, that they went ahead and did that. Are looking at what had been in place and then looking at what the department has adopted creates a shortfall of $2.36. Exactly what Director Probert has relayed and what Molly has relayed, there was in that change a decrease of program costs of about 40%. It appears that that's how the department was then, with the new methodology, able to have a wage component of about $14.34. And that's where the shortfall is in place, because the amount that we were expecting to move from 1122 labor costs up to 1594, when the department increased the wage component to $14.34, had a shorter way to go. That's where the $2.36 shortfall is generated. And I will tell you that providers have already, in good faith, knowing that this was supposed to be in place in January, accelerated increases for folks to keep them in place. We don't believe we can go back, and we will not be able to meet that floor, 1594, 125% as intended without making up the shortfall. I'm happy to answer questions that you may have.
Thank you. Yes, Representative Zager.
Thank you, Mr. Chair. Thank you, Ms. Cordes, for offering your comments. This is obviously a fast-paced developments here. I don't know if you were in the room and saw the presentation of this memo, which is describing a tripling of the amount. I think it's that basically instead of 15 million up to $46 million for Section 21 payment rates. Do you have any thoughts or comments on that in terms of how that would respond to the needs and services that you provide to our constituents?
Well, I think on the whole, when we talk about increases, that's always welcome news, and it's certainly what everybody has been fighting for to rebuild this workforce. But when you talk about Section 21, the dollars that have been presented, we're talking about all of the 45 services under that waiver. What we are asking for is a focus on agency home support and whether or not we are going to be able to meet the 125% threshold that we all intended when the budget was passed last year. With the changes that the department has made with old data without any new stakeholder input or provider input, the shortfall exists, and we will not be able to get there. Increases are, we are so grateful for all the effort and the dollars that are going into the system, but we know it will not be enough for agency home support as intended in the budget last year.
Follow up, Mr. Chair?
Sure.
One of the aspects of this whole system that seems to be struggling so much is the backup, in our emergency rooms, in our hospitals, which impacts not only the community that the Section 21 is intended to serve, but anyone seeking medical care in a hospital, which also has ramifications with ACT teams and so forth in the community. So I guess what I'm saying is that this discussion connects to so much else in the system. So my question for you, Ms. Cordes, is do you see that increase that to $46 million as providing any relief to the system as a whole, not only for the folks receiving agency home support, but the other aspects of the system? Is it going to help the system as a whole?
I think getting to the 125% as intended is a great step forward. We know that it is, that was a bipartisan proposal in a bipartisan long-term care workforce commission 3 years ago, before the pandemic, before the cost of living skyrocketed. And so we hope that it puts us on the footing to be more competitive. The most recent retention and bonuses, may also do some help, but we have lost more than 25% in the IDD community workforce. We've seen group homes closing and collapsing along with community support services. And we have open hours and open positions at a rate that we have never seen before, and new folks are not coming in. So our ability to at least get to 125% of minimum wage as intended has to be our first priority. We have folks that we have workers that have been expecting this. We have stretched as far as we can to get them, in some places, to 1550, some places 16, expecting that this is going to come through, and we need it to. Thank you.
Thank you. Luke or Molly, do you have that spreadsheet that looks through a series of dates and changes?
Sure, I can share that. Right. Is that readable for folks?
Yeah, thank you.
Yeah.
So does somebody want to walk through that, focusing on section 21 specifically?
I can do that and try to tie it into the other chart we were just showing you. So if you look at the first yellow highlighted row, this is the agency home supports code and rate under section 21. You can see that the previous rate in effect was $27.72 per hour. As of July 1, 2021, that increased 5.6% to $29.28. And assuming passage of the supplemental, the rate that will go in effect retroactive to January 1, 2022 is the $32.13, which compared to the rate in effect prior to July is almost a 16% increase. And as you're all aware, under Part Quadruple A of the budget, those rates will be adjusted annually to keep pace with inflation of the minimum wage amount. And so our projection at this point is that in January 2023, again, assuming full funding of the supplemental that was necessary in order for us to provide this level of support, that rate would increase to $33.72, which again, compared to the rate prior to July, will be a 21.6% increase. The second yellow highlighted line shows what we would be able to do without the supplemental. And so again, our effort all along has been to enable implementation of the rates that meet the legislature's intent of having labor components that support at least 125% of minimum wage. It was very complicated, as we all appreciate, certainly at this point, but without a supplemental, we cannot meet that intent. And you can see here that if the supplemental does not pass, then the rate that the appropriated dollars support for January 1, 2022 would be $29.95 instead of the $32.13 that with your passage, we hope to go retroactive to, or will go retroactive to January 1 with that amount.
So that ends up without the supplemental of being an 8% increase by 1/1/23 and a 21.6% increase by 1/1/23 with the supplemental.
That's correct. When compared to the rates that were in effect prior to July.
Right. July of 20. Yes, thank you. All right. Thank you for going through that. Thanks for pulling it up, Molly. Does this raise any questions for anybody? All right. Representative Perry.
No questions, but I do have an amendment I'd like to propose.
I think Senator Baldacci spoke first, but I'll give him a chance to bring his forward and we can get yours. Senator Baldacci, did you have an amendment that you wanted to bring forward?
Yes, Mr. Chairman, I think I circulated it by email to the committee and to Ms. Broom. But the focus of my amendment is to make sure the COLA is included with all the services. My understanding is that there's 2 services that it is not included with. Let me just pull up my amendments. So my amendment is to require that additional funds be appropriate to ensure that the additional COLA adjustment of 4.9% effective January 1st, 2022 is incorporated for, and I've listed out the services, T2021, section 21, section 29, section 20, And then 2016 U9 TGTT Section 18, which is services for adults with brain injuries, services for adults with intellectual disabilities or autism spectrum disorder, and home-based community services for adults with intellectual disabilities or autism spectrum disorder. So my understanding is that those specific services were excluded from the COLA that every other service is going to get. And I think it's extremely important that they also be included in the COLA. I mean, these are very hard to staff services to begin with, and trying to rearrange their, if you will, payment methodology, a wage methodology at this point in time when we're already talking about staff shortages and low pay is not where I want to go. So that is my amendment, Mr. Chairman. I put that forward.
Is there a second to that amendment?
Second that.
Okay, thank you. Questions, comments, discussion? So I can't find the sheet that we've referred to that was presented that lists the various entities that were included in the quadruple A. But let's start with the services and the service lines that Senator Baldacci referenced. Were those not included in the quadruple A? Is that accurate? Or yes, Director Probert.
I can speak to these particular services. So we recently conducted rate studies for the services in question, and the results of the rate studies actually recommended rate decreases for these particular services. That is because it is pretty common in rate setting for services, for example, that if you're looking at a residential setting and there's a setting that has a higher number of beds, the cost per person tends to be a little bit lower just because of economies of scale. The same thing happens when you have a service that is based in a center model versus like one-on-one or small groups. And so the rate study recommended decreases to these center-based and larger home models to reflect the fact that the per person costs tend to be lower. As we've stated, we are not decreasing any rates. What we did when Part Quadruple A was introduced is we looked at the recommended rates from these rate studies, and we said, all right, let's look at those rates. Let's add in COLA. Let's add in 125% of minimum wage. And when we did that, the resulting rates were still lower than what the current rates are in effect. And so we have kept those rates flat despite the recommendation from the rate study to reduce those rates. And that is why there is not an additional adjustment to those specific rates for COLA, because they are already above what the intent of Part Quadruple A and COLA would have been on the recommended rates that came out of the recent rate study.
Chairman, if I might.
Yes, Senator Baldacci.
I would just indicate, and I appreciate the fact that about rate studies and the need to make measured policy decisions. But I think that having a rate study influence us at this juncture, I think it's something that needs a lot more broader discussion and consideration by this committee before we entertain changes or differentiation or segregation of certain services. I think at this point, with inflation the way it is and the cost of living, these are effectively decreases by not including them in COLAs. And I think historically speaking, people with intellectual disabilities, autism, brain disorders, brain injuries those are very difficult services to staff. I would love to go over a rate study perhaps in next spring, winter or spring, we could have at some length, have a discussion about it. But in terms of making the budget decisions we have to make here, based on the work we have already done, I am very uncomfortable about excluding services at this point from a COLA increase when we should be well aware of how hard it is to staff many of these very difficult positions in the first place. So that is my position, and I ask my committee members to join with me.
Can we speak to the issue of exclusion from COLA? Are these organizations getting COLAs? As I heard Director Probert state, they are being rolled into the rates we've seen. Can you clarify that for us?
You're asking me or Director?
No, I'm
Probert?
asking Director Probert or Ben Mann.
My understanding, I don't want to interrupt, but I think she said that they're not getting the COLA increase, but I'll leave it to them to answer.
These specific codes are not receiving COLA because when applying COLA and 125% to the rates that were recommended by the rate study, the current rates are still above that level. So we did not feel it would be equitable for these specific codes to receive rate increases. Having said that, if you're talking about the providers, I would need to double check to be sure, but it is pretty common for providers to deliver services that have a number of different codes. And I also wanted to note that it is common and has been in existence to have services split out by whether it's size or different models. That is not something that is new. So it's common for providers to be billing under a number of different codes. And so they certainly would have received codes that have been adjusted for COLA in addition to these two codes that have not.
Representative Madigan?
Yeah, I just want to say that I'm going to support Senator Baldacci's amendment. As someone who first started working in this field in a residential program, a 24-hour residential program, and as someone who has administered social service programs, I, for the life of me, cannot understand why it's not a crisis that people who work in these programs cannot make a decent living now. I have said for years that when I first started working this, I made enough to pay my rent and have a car payment and keep the car insured and not starve to death. And that job came with benefits, including health insurance and all the full complement of benefits that were expected at the time. If you want a quality workforce to provide high quality care for folks that need this level of support, you have to pay for it. And I continually find it shocking, I guess, that folks that make a lot more than that make decisions that mean that people who will care for the most vulnerable among us, that they will not make enough money to survive, and they will not be able to access training, whether that be provided by an agency because they can't afford to do so, or because they can't afford the higher education to further their education in providing these very vital services. So I'm going to support Senator Baldacci's amendment. Thank you, sir.
Thank you. And I had offered Representative Perry a chance to bring her amendment forward, and then we can figure out how that interfaces with lines 145 to 152. Representative Perry, did you want to tell us what your amendment is or going to be?
Yes, and I believe Anna has a copy of it, if she'd like to put it up, explain a little bit. And really what I am doing is following up on what I really think needs to happen. First of all, my experience with the Burn study is that it was flawed. It was started with a recommendation to keep everything fiscally neutral. and resulted not only in cuts, but we also had some difficult negotiations in which we just had to agree to some things and not others. I guess remembering the battles that we had with this, I really have a great deal of angst about using this study for anything. And I really would like to see more movement forward in terms of how this would work. So my amendment is actually asking to reinstate the losses from, whatever part of that rate was decreased in both in the budget and also in quadruple A language.
Can I just ask if you're looking at the right thing? Can you see it?
Yes. So one liner bolded and two lines not. Okay. So that's T2106, which was also mentioned in Senator Baldacci's provision. And I assume that you want that to be a positive rate adjustment, Representative Perry?
Yes.
Or an increase? Yes. Representative Madigan?
I just wanted to remind folks that the family members of those who use these services, the overwhelming majority of them are taxpayers and our constituents, and they don't believe any of them have any desire for us to misuse or not use state funds wisely. All they want is for their loved ones to get adequate care.
Thank you. Representative Zager.
Thank you, Mr. Chair. I was wondering if it looks like is Laura. Yes, she is still here. The department has come forward with this increased proposal for an increase in payment rates. Can you tell us if your members would be able to increase rates based on that, with to address the need that we're seeing throughout the system?
Increase rates? Can you be specific about which?
I'm sorry, increase wages. In other words, does this meet? Could this be used to meet the need that obviously we're all trying to meet the need?
We have several different things on the table. Which are you asking about? A specific one, Representative Zager, or the three that we've been debating?
Well, both amendments and also the line item itself are the basis is that this system is breaking in part because the wages are not sufficient to get an adequate workforce to keep these homes open. And so the department has proposed this tripling, and I'm wondering if Max B has thoughts about whether that is sufficient to increase the wages so that we can make some progress on this issue.
Thank you for the question, Representative. My understanding of the proposal is really to meet the intent of last year's effort to get to 125% of minimum wage for direct care workers, as well as, should say increase and apply early the COLA, which is much appreciated, but that's being used to then get to 125% of minimum wage. Both those things, and certainly more, is I think, given this market, gets us not to a competitive wage, but to a more competitive wage. It's not only what we need, but it's what we're counting on and what we counted on when, this initiative was passed last year. The exception is agency home support, our group home rate that we've discussed that has a shortfall that I appreciate Representative Perry's amendment today. Thank you.
So,
and if I may, Senator, because there are two amendments on the table, that Representative Zager's question certainly extends to being able to lift those services and those providers who are operating in the same environment, having the same challenges in keeping staff working with adults with IDD. So the COLA is needed for those two outstanding services that were excluded as well. And thank you, Senator Baldacci, for that amendment.
So technically, just to be clear, I think of Senator Baldacci, and I'll check this with him. Was your amendment to lines 145 to 152?
It was to the lines, and I apologize if I don't have this precise, but it was for, I think, 148 to 152.
Okay, so, but it's specific to the line items that we're talking about, and Representative Perry's amendment is technically not on the table. It's the next one we'll talk about when we get through this one. But I wanna
Senator,
know- yes.
I'm sorry, can I just jump in there for a minute? Because I don't think that what Senator Baldacci is proposing really is necessarily an amendment to those lines. I think that makes it a little more confusing because those lines are specifically about services that are already getting increases of one sort or another.
Okay.
I think his request, his amendment is really a new line, just because if you're trying to put it in with what's already there, it's a lot more confusing. It sounds like its own separate initiative.
Thank you for that. Thank you for that, Luke. Molly.
Thank you. I just want to make sure that we underscore how much these services and the providers of these services are important to the department and to the state.
Did you just freeze, Molly, or? Yeah, I think you just froze, Molly.
Oh.
Do you want-
I
can hear you.
Today, 2 working days in a row.
We heard you say that these services and the members are important to the state, Molly, as I would agree with, and then you stopped for a moment.
She looks frozen still.
I know the weird thing is I can hear you.
We can hear you.
Can you kill your video? All right, well, Molly works out those things. I think I will back up from Senator Baldacci's amendment, and we will consider that as a separate line item. Oh, do you want to take another shot at what you were going to say, Molly, about appreciating family?
Thank you. Thank you. Yeah, I just, I have heard a number of comments that I just want to make sure this committee is also aware how much these providers of these services are valued by the department and the state. Our responsibility is to the members who receive these services, and that is why we have introduced, I believe in every budget proposal in this administration, additional financial supports for these providers. And I also want to make sure that we're not talking about this without the context of the HCBS bonus payments, over $120 million to providers of direct care work, 57 million of that going to these providers who ensure care for our fellow citizens with intellectual and developmental disabilities and autism. So just appreciate the opportunity to make that note.
Thank you for that. So as I started to say, if we don't consider, thank you, Luke, since Senator Baldacci's amendment really isn't to these line items, although he would reference those, it should probably be as a standalone amendment. And that leaves considerations of 145 to 152 on the table. And I understand that to be the administration's efforts in this supplemental to address some of these issues, if not to the satisfaction of anticipated levels. But so are we ready to vote on lines 145 to 152 and then go to consideration of the 2 amendments? Representative Meyer.
Thank you, Mr. Chair. I would move that we move line 145 into the budget.
Second.
It's been moved and seconded. Who was the second? I'm sorry.
Rep. Javner.
Representative Javner. Thank you.
Are we just doing line 145 or the whole group?
We're doing line 145 to 152.
Okay, because the motion that she said just one.
You're right. Let me amend that. We move line 145 to 152 into the budget.
You okay with that, Representative Javner, since you seconded it? Okay. Any further discussion? So Representative Zager.
Thank you, Mr. Chair. Does that mean with Representative Perry's amendment?
Nope, because we have to vote this one first, and then we'll get to the consideration or the voting on the two amendments.
Thank you.
Well, if we don't have to do it that way, but as Luke's pointed out, it makes a whole lot more sense than makes the accounting a lot easier and makes the tracking a lot easier.
I see. I thought that was just for Senator Baldacci's amendment, but thank you. I appreciate it.
That's for both. All right. Any other questions? Okay. So I've forgotten, it's only been what, how many days? I've forgotten. Do we use hands or do we do thumbs, or we used hands before? All those in favor of moving in line items 145 to 152 into the budget, please hold up a hand so I can see it. Electronic hand would be even better. Thank you, because that pulls everybody up at the top. Now I remember it's coming back to me. All right, I count 11, 12 in favor. And I don't see anybody else who can vote against. So thank you. If you'd put your hands down. All right. Okay. So having moved those lines in, then the question comes to Senator Baldacci's amendment, which is a amendment to the entire budget. Let's go with his first, and then we can get to Representative Perry's. Is that all right with you, Representative Perry, with your hand still up? Okay. Representative Javner.
Thank you, Senator Claxton. I do just have one clarifying question, if I may, before we vote on Senator Baldacci's amendment. Can we just hear from Director Probert once again? I thought maybe we heard this, but she needs to clarify for me. If this amendment is passed, is the rate going to be lower than what they were already receiving or going to receive because of the COLA and the amendment we just voted on?
I'm sorry, I've lost a little bit which rates you're talking about. There are no rate decreases, but Senator Claxton, if you can.
Sure. We're specifically referring to T 2021 as relates to sections 21, 29, and 20, and also T 2016. Your explanation being that those rates were not included in the COLA because the analysis showed that people were at or above where the methodology would put you. Is that a fair summary?
Yes, so what we had proposed was to keep those rates flat because those amounts are actually still above the recommended rate increases with COLA and 125% of minimum wage applied. So by applying COLA again, it's kind of like those rates, as opposed to all the other rates, are getting double COLA as compared to what the recommended rates are from the rate study.
Does that answer your question, Representative Javner?
I believe it does. So the rates are not going to fall below what they would have been receiving.
Correct.
This would raise them by the 4.9% related to the cost of living for those sections, for those line
Thank you.
Senator Baldacci.
Yeah, the only thing I want to add is that, we get thrust upon this methodology at this like 11th and a half hour about why it needs to be done this way. I think this committee needs, if we want to have a discussion, like I said, about, when we're not in the midst of trying to put together a budget that has to be done within a certain time, if we want to put together a review, which we've had the last 18 months to do, or 14 months, then we should do that when we have the resources, the time to make a deliberative decision. I think trying to exclude them at this point in time only, and these are, what we're talking about is services to people with brain injuries, people with intellectual disabilities. Unless somebody wants to tell me different, these are some of the hardest jobs to staff, and they are not the greatest paid. I don't think that's changed. So giving them an extra $20, $40, $60 a week so they can support their families, if anything, hopefully makes these jobs something they stay doing and serving people. But I think that for us to buy into a methodology and separate these services out is really a disservice to both the workers and the people in those services. I'm happy to entertain a real lengthy discussion on rates when we have more time to do that, perhaps next year. But to do it now, I think does a disservice to the people we're trying to help. Thank you.
Molly.
Thank you. I just wanted to clarify that the methodology we're discussing has been in place since July 2021. So the methodology is not being voted on in the budget.
Okay. All right.
And we made these decisions, Mr. Chairman, prior to that date. And then we didn't meet again until January. So I think that if we want to have a discussion where our input is.
I think you've made your point about a deliberative discussion. I think Molly was clarifying a piece of that. So thank you. Any other thoughts, comments, questions? Are we ready to vote on that amendment from Senator Baldacci? That selective portions of Section 21 get an additional COLA, 4.9%. That's the motion on the floor. Senator Baldacci made it, and I think it was seconded by Representative Perry. Is there any further discussion? All those in favor of Senator Baldacci's motion, please raise your hands. I count 12. And nobody present to vote against. Okay, thank you. All right, that gets us to Representative Meyer. Did you have your hand still up or step away? Okay. So that gets us to Representative Perry's amendment. I don't have a second on your amendment. If you wanted to repeat it again, Representative Perry.
I second it.
Okay, thank you. Representative Craven has filled in the second slot, and it was to increase by $2.36 an hour, the allotment in the personnel line for which section? Do you want to speak to that, Representative Perry, as to whom that would apply? I can't hear you. I'm not hearing through your mute.
I know I'm looking at other parts of my computer. I'm trying to pull it up. And so bear with me here.
I know the feeling.
Okay. The amendment really it goes into AAA for Section 21. It's a $2.36 rate adjustment for agency home support hourly rate. That's specifically what that's about. And it just has the language change that needs to go with that as well.
And is that clear enough to you, Anna or Sam, about what's intended?
Sure. And I just want to let you know that I did email it to the committee because I realized that some people wouldn't have it.
And I do want to ask Representative Perry, just to make sure, in the email that you send Representative Perry, you say Section 21 Agency Home Support, use the code T2106. I believe you meant T2016. but I just want to make sure for calculations purposes.
Actually, I don't know what one I meant. Where does it fit to accomplish what I want to accomplish?
She wants to increase agency home support. What's the line item for that?
Yeah, I'm going now. I have to open the section of policy because I can only go off of what you wrote on the email, and I don't want to do the wrong thing. So,
Senator Claxton, perhaps Laura can specifically address that. Which
Okay,
code
I
we're
didn't-
looking at.
I didn't see. Are you still with us there? There you are,
Yes,
Laura. Go ahead.
thank you. It's T2016, Section 21, Agency Home Support Hour.
Okay.
Thank you.
Does that answer your question, Luke, for the calculation? And
it does. I just wanted to make sure it was right code. Thank you.
thank you, Senator Moore, for that suggestion. Any other comments? The motion on the floor is to increase by $2.36 per hour, adjusting up the rate for agency home support, Section 21 T2016. All those in favor of moving this into the budget as an amendment, please raise your hands. I count 12. Thank you. And as I understand it, that takes care of the items that were on the table and the first pass at any amendments. Are there additional amendments to come before the committee? Representative Perry?
Yes, I would like to put into the budget Representative Klucher's bill regarding the $5 million for tobacco coming out of the health and let me see. The thank you, Fund for Healthy Maine. To replace that as it had been lost over this biennium.
So you want to move LD 1868 at $5 million a year into the budget?
Yes.
And is there a second for that?
Second.
Second.
Thank you, Representative Craven. Is there any discussion about that? Yes, Representative Jabner?
Thank you, Senator Claxton. Just for refresher, can you just remind us, this was a bill that we have voted upon already in our committee?
This was LD 1868. It was $5 million, and we voted unanimously to forward it out of committee.
Thank you.
The issue is now is whether we have to move it into the budget. Any other questions or discussions? All those in favor of moving LD 1868 to $5 million a year into the budget, please raise your hand. Senator, okay, is anybody not voted yes? Representative Lemelin makes it 12. Thank you. All right.
Mr. Chair.
Yes, Representative Craven. Please put your hands down, everybody, but Representative Craven.
Yeah, thank you, Mr. Chair. I would like to move into the budget LD 1501. That is regarding children's oral health care, which was voted out unanimously out of this committee.
Yes, that was access to oral health screening, education, and fluoride, and restores the oral health coordinator position. And the fiscal note was 300,000.
Second.
Thank you. Any discussion, questions? All those in favor of moving LD 1501 into the budget, please raise your hand. my count 12.
Chairman?
Yep. Wait a minute. Let's do that again. I looked up twice and it's changed already. So Representative Perry and Representative Lemelin, had you voted? Okay, so that makes it 12. I was right. Thank you.
Mr. Chairman?
Yes, Senator Baldacci.
Hey, want to present an amendment to include the PNMIs and the nursing homes for the 125% increase. Believe that Angela's in the waiting room who can discuss that.
Okay. Have we brought Angela in yet? Angela Westoff?
Hi, good afternoon. Do we have an amendment?
No,
Circulated.
we were just, it was a voiced amendment. I
Yes.
haven't seen any documentation, Senator Baldacci.
I can circulate that in just a moment. Thank you. I would just ask her to speak on that issue, but I would make that verbal motion and I will, but basically to extend the 125% to nursing homes and the PNMIs. But I will circulate that in a moment.
Is there a second for that motion?
Second.
Representative Craven. All right. Did Representative Stover, is your hand up intentionally? Okay. Luke.
So I'm just a little confused about that amendment because as far as everything goes, Section 97 and nurse facilities already were part of quadruple A. So I guess I'm just not quite sure what the request is.
And that specifically was not only for the COLAs, but also for the 125%. Is that your understanding?
Well, quadruple A is the 125%. The COLAs are sort of the separate
Right.
piece. But so that's why I'm just confused because they already were included in quadruple A. And there was funding for that in the biennial budget. So I'm just trying to understand exactly what this.
I think it has to go to the methodology issue that we just discussed in the other regard, where we increased the rate despite their methodology and despite what was presented to us in the methodology. We approved Representative Perry's amendment. And my amendment is to extend that to also the workers in nursing homes and PNMIs would be the same language as Representative Perry's amendment, but to extend it to nursing homes and PNMI workers.
So the difference was, or part of the challenge is that Representative Perry's included a specific per hour rate. And I have no idea how to get from where we are to where you want to go based on the fact that we don't have a per hour rate. That's something you'd need, right, Luke?
Exactly, yes.
Well, I will work on doing that. And if we could pass on that and I can come back to it, that'd be great.
So all those in favor of tabling Senator Baldacci's motion about PNMIs and nursing homes, please raise your hand and we'll table it. Very good. Okay. Now, if everybody will put their hands down, are there other motions, any other amendments that people would like to propose related to the budget? Senator Moore.
Thank you, Senator Claxton. I'm over here searching for the amount. I would make the motion that we move in LD 415 to raise the rate for Section 13 case management services. And I can't find the exact number of what that comes to.
2.5 million.
I would second that.
So the motion is made and seconded to move an LD 415 into the budget. The fiscal note on that was 2.5 million to expand target management for substance use disorder. It pulls down 6.4 million federal. It was unanimous vote out of the committee. Is there additional discussion about moving LD 415 into the budget? I'm not seeing any, so please raise your electronic hand if you're in favor of that motion. Five, 10, 11. And somebody, who are we missing?
We got 12, Senator.
Oh, there we are. Okay, yeah. People are moving around. 12, thank you. Okay, that was made by Senator Moore and seconded by Representative Meyer. All right. Any other motions to come before the committee? Well, you all seem to be having fun, so I'm going to move that LD 85 be moved into the budget. That's the donor breast milk access for sick newborns. The fiscal note on that is $158,000.
I would second that.
Out of HHS unanimously. Been moved and seconded. Is there any discussion about that? All those in favor of moving in LD 85, please raise your hands. That gets us to 12. Okay. Thank you. Please put your hands down. Any other motions? Senator Baldacci.
Mr. Chairman, I don't have the exact LD number, but it was in a spreadsheet, LD 12 something, about providing, addressing direct care shortage.
Yes, that'd be LD 1204.
That is LD 1204. It passed this committee unanimously last year. It would require the department to get a federal waiver to allow parents in some circumstances to be the direct care workers when a direct care worker cannot be found. And the fiscal note was just over 100,000. And I think it pulled in close to 200,000 of federal money.
111,000 was the fiscal note, 198,000 was the federal poll. Yeah.
Right. And it had bipartisan support, not only in this committee, but I believe Senator Paul Davis was a co-sponsor. I would ask that that be included in the budget.
So that's a motion to pull in LD 1204 from Senator Baldacci.
Second.
Seconded by Representative Perry. Thank you. Any discussion about moving that into the budget? All those in favor of moving LD 1204 into the budget, please raise your hands. 10, 11, and Representative Stover makes 12. Thank you. Hands down, please. Any other amendments to come? Yes, Representative Zager.
Thank you, Mr. Chair. I'd move LD 496 into the budget.
That would increase section 65 main care by 25%. It would pull down 21.5 million federal, and the fiscal note was 9.2 million. It was unanimously passed, and it was passed in the House and ended up on the appropriations table. Is there a second for Representative Zager's motion?
Second.
I'm sorry, was that, thank you, Representative Madigan. That was LD 496. Any discussion? All those in favor of moving LD 496 into the budget, please raise your hand. I get 4, 8, 12. Thank you. All right. Hands down, please. Any, oh, yes, Representative Madigan, is your hand up?
Yes, I'd like to make a motion to move in LD 582 into the budget. That is the bill having to do with an increase in assertive community treatment team rates. And it's sitting on the appropriations table, and it was a unanimous report by this committee.
I second.
Then the fiscal note was 624,000 and it pulled 1.5 million federal. LD 582. Any discussion about that? All those in favor of moving in LD 582 to the budget, please raise your electronic hands. I get to 12 again. Thank you. Okay. Hands down, please. Representative Meyer, did you want to?
Yes, thank you,
Any
Mr.
motion?
Chair. I would move LD 432 into the budget.
Second.
That's behavioral health support for children. It's currently on the AFA table. We supported it unanimously in HHS, and the fiscal note is 133,000. So that was my, and who seconded that?
Representative Madigan seconded.
Thank you. So that's LD 432. Any discussions about that? Okay, all those in favor of moving in LD 432, please raise your electronic hand. $12. Okay. Hands down, please. Representative Myers, your hand up again?
It is.
Okay.
I would move, bear with me for 1 second, LD 972 into the budget. 972.
LD 972 is the Rare Disease Advisory Council. It changes the makeup a little bit and it adds a half-time coordinator. We passed that out of HHS unanimously, and it was passed in the House. The fiscal note is $65,000.
Second.
Thank you. Any further discussion of LD 972? All those in favor of, in support of moving this into the budget, please raise your electronic hand. 12. Thank you. Please put your hands down. Representative Zager.
Thank you, Mr. Chair. I move LD 1787, the FQHC rate setting proposal into the budget.
Second.
That was the rebasing we talked about. We unanimously passed that. The estimated fiscal note is 6 million, and the department has committed to getting the rebasing done already. Any further discussion of LD 1787? Okay. Please put up your electronic hand if you're in favor of moving in LD 1787. And get 12. All right.
Chairman, I have circulated the amendment.
Okay, so if you'll give us a minute to go to our legislative email box. Okay. Representative Madigan, did you have a comment or question? Senator Moore, how about you? Okay. So we need a motion to take it off the table because it was tabled
Take it
just a
off the
little bit
table.
ago.
I move to take it off the table.
I hear moved and seconded. All those in favor of taking it off the table, we can do this with a show of hands. Okay, thank you. So now we'll move to consideration of Senator Baldacci's bill with the amended language to increase similar to Representative Perry's bill at $2.36 an hour for, I want to be right here, sections 67 and 97, retroactive to January of 22.
What line of the budget is this?
I would probably defer to our seasoned staff.
This would, I think this is like the other instances we've considered. It's a separate standalone amendment just in terms of keeping it clean, but I'll ask Luke if that's the best way to do it.
Yeah, I think that makes sense. I do have a question. So section 97 is included here. There are many appendices for section 97. And so I'm still not clear on exactly
Nor I.
What we're trying to accomplish here, because there's a lot of different rates within those appendices as well. So it's just very confusing.
Okay, Representative Javner, did you have your hand up?
Yes, thank you, Senator Claxton. I am right there with Luke. I'm very confused about where this is affecting, what is affecting, and maybe as well, I would really appreciate hearing from the department or Luke, someone who can clear up where this is affecting us in the budget pieces. Thank you.
Okay. Thank you for an attempt to help clarify things. So is that something you want to work on, Senator Baldacci, and get back to us?
Yeah, I'm happy to get back to people. I understand, we're working on a compressed time frame, but I'm happy to work on this. Is this something that we can revisit later this week, Mr.
No,
Chairman?
we're talking about revisiting it later in the next hour.
Okay.
So we're done with the budget here. We're done with the budget here.
Yes, I'm happy to work on it.
So before I give you that homework, Luke, what else would you need? What other questions can you think of that might need to get answered if you can extrapolate from what Senator Baldacci's offered?
Sure. So I'll explain it with the previous amendment that this is sort of similar to, which was Representative Perry's amendment. In that the language that was given that clarifies exactly what I'm doing is it gave me the specific code and the name of the service in this case, because within section 21, the code T2016 is used, I think, probably 11 or 12 times. But what Representative Perry was specifically asking about was agency home support, which clarified for me the two codes that are actually the ones that are being increased. And it was a specific dollar amount increase to those rates. So with that, I will be able to go and clarify that. I'll be able to figure out what that would do. But with this, it's just not as clear exactly what's happening in section 67 and in some of section 97. Section 97 is really difficult because there are multiple appendices and the way the rates are calculated is different in those appendices. So it's not just clear across the board. At least in section 67, I can say that the actual rates that are paid to facilities are done on a facility by facility basis, where they're each paid their own per diem rate that's calculated ahead of time by the department. The department goes through a whole long process where they calculate what the per diem is for every facility, lets the facility know at the beginning of the year, here's your per diem rate this year, that's the rate. And so just saying to increase by $2.36 per hour, I think what that would be saying is that the wage portion of the calculation that came up with the per diem has to increase by $2.36 an hour. I think that's what that's saying. But again, for Section 97, it's just not as clear because of the intricacies there. If it's Section 97 Appendix C, which is often the one that's considered similar to the nursing facilities because it's kind of the assisted living facilities that are often owned by a lot of nursing facilities, that is calculated in a fairly similar way. And so I think I could go with that. But just saying Section 97 increased the hourly rate by $2.36 an hour, I just don't know where to go because I don't have the clarity on exactly which rate is being increased and how, so that I can have some idea of how much this might cost, which quite honestly, to get that answer, I likely have to go through the department. But also to figure out how to draft the Blippi or some additional language to make it all clear exactly what's happening.
So
Well,
before we
fair.
get to some more information, I'd like to, I want to ask a question. Can I see a show of hands of who has additional amendments to offer before we get done with the consideration of the budget? Can show of hands? I see 1, 2, and I have 1, so that's 3 others. We've been sitting for 2 hours. I think we ought to take a 15-minute break while Senator Baldacci has a chance to do some clarifying work, and then we'll reconvene at 3:15. Everybody okay with that? Thank you.
Thank you, Representative Madigan. Keep them coming.
I get so confused. There's so many of them.
There was a bunch that went out, and so I appreciate your responding to everything today. And then there will be more today as the votes closed. Just one more for you today, but it hasn't been out yet. I'm trying to get everything that was out once. So thank you so much.
Yeah, no, I get so confused because like sometimes people hit reply all and I'm like, ah.
Yes, agreed. Thank you.
You're welcome.
So when we left committee work, we'd understood there were 3 amendments to go, and we were in the midst of considering Senator Baldacci's amendment. Is Luke on or available?
Yes, I'm here.
Maybe somebody from either Luke or somebody from the department. Can you tell me what the per diem rate is for nursing homes currently and PNMICs? And is that specific enough a question?
Well, I'll say there isn't one per diem. It's not just one rate. And I think it might be good for the department maybe to speak to it because they definitely know more about how it's all calculated and everything. But from my understanding of it, it's a per diem per facility. So there's not just one rate for Section 67 or the Section 97 PNMICs.
Is that something that Michelle or Molly wants to fill in for us? The issue being that the request from that world is for specific increases in per diem for nursing home and PNMICs. And I don't know where we're starting, and I don't know how big a jump what's being asked for is, and I want to know before I say anything more to clarify.
Or I'm not sure what we can answer. We just literally got the email, and so I've shared it around, but don't have much more understanding of what we're looking at than you do. Although if there are specific questions, we will do our best.
So there's 2 emails, one at 2:52 and one at 3:16. The one at 3:16 at least is more specific on 67 and on 97 PNICs. Are there multiple of those in those categories?
So I have an email forwarded to me from 3:16.
Yeah.
I don't have one from earlier.
Okay, well, you can ignore the one from earlier because it wasn't helpful. The 3:16 was at least specific enough to point us in a direction. And I'll read that just so it's on the mic. Incorporate into the supplemental budget the additional funding needed to increase Section 6 nursing facility services, $25.40 per patient day for January through June of fiscal year 22. And I assume that means all of fiscal year 23. It's Section 97 PNMIC. The request is $32.25 per patient per day for January through June of 22 and for fiscal year 23. That's the memo that I'm reading, and I want to make sure that it's on mic.
Mr. Chairman, can I ask respectfully if Angela Westhoff could at least come speak on the amendment, so she might be able to provide some clarity or answer.
Yes, you can. But before we do that, I want to make sure that we have enough specificity to know what the amendment is.
Well, that's what I would ask her to help address, because my understanding is that facilities are reimbursed on a per day basis, and there are no specific codes to provide. So
right, but I also understand there's different reimbursement rates per nursing home or per bed, depending upon the nature of the person occupying the bed. Is that right, Director Probert or Molly? So there is not one PNMIC rate across all of those facilities. And there's not one Section 67 rate across all nursing homes. Okay. And Angela Westhoff isn't available to us that I see.
Yes, she's right here.
She's right here.
Oh, she made it in. Okay. Oh, there you are. Okay. It's hard to keep track of all these checklists. All right. Okay. So Ms. Westhoff, Angela Westhoff, welcome.
Thank you. Thank you, Senator Claxton.
And you heard the questions I was asking to get to a point of clarity. We have a per diem rate increase ask, but we have multiple per diem rates. Is it across the board the same increase for all rates?
Yes, so we were just pointing out that there's no funding in the supplemental budget to address the 125% of minimum wage. There certainly was some funding allocated in LD 221 through part quadruple A of the budget. So based upon a third-party actuarial analysis through Barry Dunn, we have calculated the cost needed to achieve 125% minimum wage in the labor component of the daily rate. So for Section 67 providers, which are nursing home providers, that would be a $25.40 per patient day add-on. And for PNMICs or Section 97 Appendix C providers, that would be $32.25.
And a question I asked earlier was about what the current rate is for nursing home and PNMIC on average.
Yeah, great question. And that would vary based upon case mix, but roughly, at least for nursing homes, about $274 per day.
And how about for PNMICs and assisted living?
That's less. I believe it's about $134 per day.
Okay. So the increase in nursing homes will be about 12%, no less than that. But it would bring it up pretty close to $300 a day.
Correct.
On average.
Correct.
And the PNMICs, it would bring them up to 166 per day.
Yes.
And okay, and yes, Senator Moore.
Well, I guess I'm getting more confused as we go along. You know, referring to that Appendix A and the memorandum that we received with a response to all of our questions. You know, 67 is already listed on here as getting the quadruple A, getting the COLA for July 2022, getting the 125% January 2022, and then they're up for a rate study starting in for the beginning in 2023. And the same with the 997, which is the PNMIC, it's showing exactly the same thing. So it sounds to me like we're already including them in the COLA and the 125%. Am I understanding that correct, Shal? I don't.
Is that directed to me?
No, I think we went to Director Probert.
That is correct, Senator Moore. I can add to that statement that the department is fully committed to fully funding part quadruple A. We have concerns about the numbers that have been presented by this amendment.
Any other comments? Representative Meyer?
Thank you, Mr. Chair. How did we reach these numbers? What methodology was used to reach these particular numbers?
Is that something you want to speak to, Angela?
Sure, I'd be happy to. Yeah, I was just waiting to see who the question was directed. So we employed the use of a third-party actuarial firm called Barry Dunn. Barry Dunn calculated the shortfall in the labor components of our rate specific to certified nurse aides, med techs, and ward clerks. Those are 3 classifications of employees who provide direct service and assist with the activities of daily living for residents in nursing homes and private non-medical institution Appendix Cs. So looking at the minimum wage that's included in the rates over the years, including the COLAs that have been added on to that, and then calculating the shortfall between the hourly wage, which is supported at $9.24 for PNMICs. So to get to $15.94 per hour, that's a difference of $6.70. When you factor in benefit costs and multiply that by the number of Medicaid resident days, you get approximately $36 million. The state share of that would be $10,900,000. Similarly, for nursing facilities, when you calculate the labor portion of the rate that is covered, it's presently $11.80. The delta between $11.80 to $15.94, which would be the new floor for the fully funded 125% of minimum wage, would be a difference of $4.14. When you add in the cost of benefits and you multiply that times the number of main care nursing home days, you arrive at $37,138,000. The state general fund share of that would be about approximately $11 million.
And the state portion of the PNMI would be 10.9.
Correct.
Any thoughts, questions? Yes, Representative Perry.
Yeah, this sounds terrible, but I'm trying to make heads or tails of this one. If they are already in the AAA in terms of what is being mentioned and what is being proposed, my question is, this sounds more like a math issue than a rate study or policy issue, as a rate study is coming up for 2023. I'm really confused. I've got to say I am hesitant to vote for this simply because of that.
Thank you. Senator Baldacci?
I would just note that I think the basis of this is the same basis as the vote on the other, is that the methodology being used to achieve certain goals by the department is different than what outside expert methodologies would suggest is needed in order to meet those same goals. So I understand that there's a stated goal, there's money provided, but I think the analysis that Ms. Westhoff was referring to is that the money provided will not meet those goals based on the actual operating costs of the nursing homes and the PNMIs. And I would just indicate that this is another area where we are seeing shortages, not only of workers, but of places closing. And we're threatened with more nursing home closures. So I think that we're trying to err on the side of caution to prevent further closures of nursing homes and make sure they can attract sufficient workers. So at a minimum, what the amendments tries to seek is to make sure that, notwithstanding whatever methodology the department's using, that these wages are met, that these increases are met. So that's the purpose of the amendment.
Thank you. Representative Javner?
Thank you, Senator Claxton. We have addressed this issue, I feel, in the previous lines of the supplemental budget. I really feel that right now at this point, the department is doing their absolute best to move forward with what they have been given. And I will not be supporting this amendment. Thank you.
Thank you. Any other comments? Would the department like an opportunity to explain their thinking about their methodology or the the gap between anticipated and actual. If not, that's fine, but I just want to make sure you had a chance.
Yeah, we really can't comment any further on this.
Okay.
We haven't had the opportunity to review. Thanks.
Okay. So at this point, are we ready to vote? There's a motion on the floor. That's been restated several times for add-ons to the nursing home rate and the PNMIC rate. Representative Zager.
Thank you, Mr. Chair. I guess I'm looking at a administration press release from late December, which talks about these payments for long-term care facilities would support the 125% minimum wage to direct care workers. And I'm just trying to connect that to what Ms. Westhoff was just saying that that's not actually happening. And so perhaps perhaps the department or she would like to comment on that.
I think she just did, saying, yes, go ahead, Ms. Westhoff.
Thank you, Representative Zager, and thank you, Senator Claxton, for the question. I appreciate it. Essentially, the funding that's been previously allocated is grossly insufficient to meet the 125% of minimum wage, and there is $0 allocated in this supplemental budget to address this problem for nursing homes and long-term care facilities. You're well aware of the 6 closures that we've already had and a couple of additional imminent closures. And as was mentioned in the press release, these rates were supposed to be in effect on January 1st of 2022. Workers have come to expect them in their paychecks. We've actually had one facility report 5 CNAs that quit en masse as a result of not seeing any increase in their paycheck. There certainly has been recruitment and retention bonuses paid with COVID-19 supplemental relief dollars. Those are one-time dollars. What we're advocating for here is for, just like you have with other provider groups, you've made an investment in direct care workers. These are the CNAs, the med techs, the ward clerks that are the backbone of the care provider team that are taking care of our oldest, our frailest, and our developmentally challenged adults and young folks. So to be able to provide for their family, we're asking for your indulgence on a rate add-on that would get us to where we need to be able to support those wages in the per diem rate for nursing homes and appendix PNMICs. I thank you for the question.
Any other thoughts? Yes, Molly.
Sure, and I would just add that, thank you. And we have stated already that we're committed to fully funding the 125% in nursing facility rates. And if additional funds are needed down the road in order to fulfill that, we'll request them through a budget initiative. But we have made that commitment and continue to be clear on that. Thank you.
Representative Meyer.
Thank you, Mr. Chair. I would ask for a corner caucus, please. I am not ready to vote on this. I feel like there are too many unknowns. The figures are new to me and to this committee, and I would ask that we caucus before we take any votes on this initiative.
So why don't we take a 10-minute caucus, and we'll get back together when Representative Javner's face shows up and my face shows up, and hopefully be about 10 minutes. Okay, thank you all. So we're back and restarting a little bit later than intended, but so at this point, we're in the midst of a conversation about an amendment. I'll go to Senator Baldacci.
Thank you, Mr. Chairman. I have two requests. One is I would ask to withdraw my currently pending amendment with the permission of the chair.
That's fine.
Okay. And then I would ask to, last year we passed LD 949. We passed it unanimously. It provided a one-time appropriation of 20 million to nursing homes, which would have also garnered an additional 70 million federal funding. I would ask, because that, even though it passed unanimously here, it was left on the appropriations table. I would ask that this committee ask that be included as part of the budget for this year, and that the LD be amended to be updated in terms of fiscal year reference appropriately, but that we ask that be part of the budget instead. That way we're not directly addressing rates, changing rates, but we are trying to help make sure the nursing homes are kept open and are able to attract workers, which I think is something that we share on regardless of party. I think it's something that we all want for our seniors and our communities. That is my motion, Mr. Chairman.
Is there a second?
A second that.
Is that Representative Stover? Thank you. So there's a new, yes, Senator Moore.
Yes, thank you, Senator Claxton. I guess I understand where Senator Baldacci is referring to. However, I believe we have already moved several lines into the budget. I'm showing lines 218 through 224. We're providing one-time funding for add-on payments to the accounts, and it addresses for nursing facilities and residential care facilities. And it shows that to be an amount of 458. Well, the total actually was 1.9 million general fund. So I'm thinking we've already taken care of what you're trying to accomplish, Senator Baldacci.
1.9 million, is that what you said? Yeah, this bill was a 20 million one-time appropriation by the state that was, and that would attract another 70 million in federal money.
Just to be clear, it would have done it under the circumstances of it being a year ago. It may not do it at this point now. So this would just be a one-time appropriation bridge ramp until rates got readjusted.
That's correct. Thank you.
And I see what you mean, Senator Moore. It's general fund 450 and then another 1.3 and then another 171.
Senator Claxton, just because I did have a document that was just about one-time COVID numbers, so I have the total for that one.
Okay.
There were two separate initiatives that were about nursing facilities and residential care facilities. One was funding in state fiscal year 22. And yeah, that was a total of 1.9 million general fund with federal and other special revenue was 7.6 million. But there was another supplemental payments to long-term care providers that was in state fiscal year 23 that had another 7.5 million of general fund. And that one was a total of $25 million. So just those two initiatives on their own that have already been voted in the initiatives of this supplemental budget, it's 32.6 million of all funds going to those nursing facilities.
32.6 million of state funds or when you're including federal funds?
All funds. It's 32.6 of all funds. And in total, it's 9.5 million of general funds.
Right. So the other, the LD 949 was $20 million appropriation. And most of that money at that time was going to come from unspent funds the department had not spent because of the lack of occupancy in nursing homes because of the pandemic. But I would ask that 949 be asked to be part of the budget and let the appropriations committee try to sort out the total numbers. But I think we're facing a crisis in the nursing home situation that we don't want to see grow. And we face the threat that this is going to grow and that they're going to have continued financial challenges, which we are trying to avert on several different levels. Thank you.
Any thoughts? So the motion on the floor is to resurrect LD 949 and move it into the budget. Representative Jadner.
Thank you, Senator Claxton. In light of what Senator Moore has shared, I really think that there is a huge piece that we are doing the best that we can to address these shortfalls, to address the issues that our long-term care providers are facing. And I will not be supporting moving this bill into the supplemental budget. Thank you.
Thank you. Luke?
So sorry, I'm just trying to clarify everything because I was a little confused as well by one thing, which is the language of LD 949 was already put in the biennial budget. It's part of the biennial budget that was proposed. It's part 4Q, QQ.
But the bill is still on the table and we're still having still on the appropriations table. And we're still having this discussion over how to help avert the closures. So LD 949 still exists on the appropriations table and the situation still exists that nursing homes still need money. So
I think I understand that, Senator Baldacci. I'm just confused because I know it sits on the appropriations table because it was a separate bill, but all the language that was in it was put in the biennial budget. So what I'm struggling with is how to take language that the legislature already passed in the biennial budget and again put it in this supplemental budget and somehow have it be different. That's what I'm just struggling with, because when I heard LD 949 I started running around a bit because I remembered that and I remembered it going in the biennial budget. So that's what I'm struggling with. I'm just trying to understand how 949 is going to accomplish something new if it's already in the biennial budget. That's, I guess, what I'm asking.
Thank you. Representative Perry?
Yeah, I guess my question is did the funding go with the language?
So the way LD 949 was drafted, essentially there was no funding to go along with it. There was some specific federal funding that it said to allocate a certain portion of the funding for certain things. And there was, I think, general fund funding expected to be spent, but it was to appropriate funds that the department already had. So there was no additional funding provided as part of LD 949. It basically outlined how specific portions of money the department already had should be spent.
So was that money appropriated then?
Luke, are you researching that?
I'm sorry, what do you mean researching?
Well, I think Representative asked you a question about whether the money had been appropriated because it was in the language QQQQ.
Oh, sorry. Was I on mute that whole time?
Yes, you were.
Oh, so much fun.
I couldn't tell. Your head was down.
So there was no specific funding provided in the budget for Part QQQQ because LD 949, the way it was drafted, wasn't about appropriating new money. It was about identifying how certain general fund dollars and certain federal funds should be allocated specifically to nursing homes and PNMI Appendix Cs. So there was no specific funding in the bill. It just talks about how the funding should be spent.
Was that funding then allocated? I think the question I really have is if that was extra money and the request was for 20 million of stuff of monies that were already in the department, was that then allocated to that area?
Well, I guess I can't say. That would have to come from the department because I don't actually move the money around once a bill's been passed. So all I can say is that the language from 949 was in the budget.
That's an allocation question. Yeah, does Molly or Michelle want to weigh in on whether that money got to nursing homes or not? I'll go to Representative Zager first.
Thank you, Mr. Chair. It seems to me like we can meet the intent of what Senator Baldacci raised. Even if it's the same language, we can we could augment the line item or add propose an amendment for another line to get it to the level that Senator Baldacci spoke about, because the other lines that have been mentioned are much less than what he was supposing. I'm not sure exactly what technically we would need to do to achieve that, but it seems that we could choose to do that as a committee.
Well, can we clarify one more time, Luke, what is in the current green, on the current green pages that has been moved in that would address PNMICs and 97 to partially answer the question that Representative Zager implied?
Sure. So, yes. So the specific funding that I had identified was the funding that was the one-time COVID funding that was in the initiatives in the supplemental budget that's already been voted in. Mm-hmm. And in that, there's a total of 32.6 million of funding going to nursing homes and PNMICs. Of that 32.6, 9.5 million is general fund. So that's the funding that you all have already voted in to the supplemental budget. That is specifically one-time supplemental funding going to those facilities.
Is that 218?
Yes.
Yeah, 218 through 230 are the lines that they're broken in two separate initiatives. Because the 22 funding is one initiative and the 23 funding is another, but they're those lines.
Yeah, and then 197 is.
Sorry, back. I have to.
Excuse me, Senator Claxton.
Yes, Sorry, Representative Jabner.
It's okay. Could I just please ask, maybe Luke, if you could share that document that you had put together, is that a possibility?
On screen right now?
Yes, please, so that everyone
Sure,
can see that
I can definitely
together.
do that. Give me a
Thank you.
second to.
Luke's right Michelle's right, Representative Myers right. If you include 197 through 199, that's another 5 million general fund dollars.
Yes, so that is initiatives, what you were saying, lines 197 through 199. Yes.
Yes.
That's additional one-time funding that are specifically for those facilities. PNMICs specifically.
Mm-hmm.
All right, so I now have on screen the file I've just been referring to. So lines 218 through 224 here are the ones you see here for state fiscal year 22. And you can see that it's 1.9 million general fund, just under 500,000 of other special revenue, and just over 5.2 million of federal, for a total of 7.6 million funding in state fiscal year 22. And then if I move on, you have lines 225 through 230, and these are just state fiscal year 23, and the general fund is 7.5 million. The other special revenue is just under 1.5 million. And the federal is 16 million, for a total of 25 million in state fiscal year 23. And I do believe this document is also up on the HHS committee supplemental budget documents page, if anyone else wants to see it.
Thank you, Luke. Senator Baldacci.
I understand the technical analysis. But the fact is that nursing homes are still closing. The fact is that workers aren't getting paid what they should be. These allocations that we're referring to were for specific purposes. They aren't all including raising wages. And just to be clear, when we had the public hearing last year on 949, I had to change it to make it a straight appropriation. I understand the original language of 949, but I distinctly recall that we had to make it a distinct appropriation because of technical issues that were raised. So I would just ask, I think at some level we need to augment what we're providing nursing homes. I'm trying to use this 949 as a vehicle without having to change the long-term rates that are going to be subject to a rate study in any event. And I understand some of the committee's concerns, but if people aren't interested in trying to help make sure nursing homes are closed or not, then that's fine. But I think we have to.
I think that's unfair to state it that way, Senator Baldacci. Just because they don't agree with you as the way to fund it doesn't mean we don't want to fund them.
Right, I understand that, but I'm just saying we can either try to do what we can to avert closures, which are happening, or not. So I think that we need to figure out a way to augment what we're giving nursing homes in order to prevent further closures.
I hear that, and they haven't gotten this money out of the supplemental yet, have they? No, it's still on the green papers.
They haven't got that money, but from what we've heard, they've also not gotten the allocation that was promised in that biennial budget. Not all that money has been distributed, and I think the administration has previously.
Well, that's a different issue we can't approach in discussing the supplemental budget.
I understand, but the reality of things, they have not received that allocation either. So in full. So those are my thoughts. Whatever the committee wants to do, but I honestly feel that we can't just sit by and let nursing homes close. Thank you.
I hear that. Representative Jevner.
Thank you, Senator Claxton. by all means, we all agree, we want to stop the closing of nursing homes. That is without question. I think that I have a quick question though, from what I heard Senator Baldacci just say, is his mindset in thinking that the 20 million appropriated in LD 949 will go directly toward wages? Is that what I heard?
I think I think that was what was implied, was that we weren't doing enough to support wages, and that money would allow it to go to wages, is what I hope I heard. Because we don't control where it goes. We just give it to the entity on a per diem basis, and they figure out how to allocate internally. Is that the point you were asking about, Representative Javner?
Yes, thank you. That's exactly what I'm asking.
Yeah, that's what I heard. Okay. Representative Perry?
Yes, a couple of times, Mr. Mann had become in view. And I think it was to answer my question around the allocation piece, which I still haven't got an answer to. So I'm hoping that he can come back on and respond to that.
And your question was?
Was it allocated?
Right. And I'm not seeing him. There you are, lower right-hand corner. Thank you, Ben, for being here. Did you want to answer Representative Perry's question?
Yes. In response to Representative Perry's question, the $20 million was combined with another $10 million of general fund. And the department pushed out $123 million supplemental payment in September and October of last year. That is good until June 30th of this year, and we recently extended it till December 31st of the end of this calendar year.
Thank you.
Speak to the balance in that account right now?
I do not. You would have to ask providers or the Nursing Facility Association for that.
No, but I mean, but it's out of our treasury. It's been distributed.
All of it in September and October.
That's what I was asking.
2021.
Okay. Thank you. That's what I was asking. All right. Any other thoughts? Representative Perry.
The reason I'm asking that essentially means that LD 949 was accomplished according to what we had put in that bill. And it may not have been part of an appropriation, but it was allocated. With all the confusion, with all of the ups and downs about this, I know I seconded this, but I really don't think I can support it.
Okay.
I would probably ask if we could have another corner caucus though, before we vote.
We try to respect those requests. So we'll reconvene in as close to 10 minutes as possible. Okay, we're back, and I'll recognize Senator Baldacci.
Thank you, Mr. Chairman. Upon further reflection, I would ask to withdraw my request at this point, and we will, obviously, this is going to be a continuing issue, but I will withdraw my request for those amendments. Thank you.
Thank you. All right. When we left the discussion before our break, I understood there were several more amendments to be brought forward. I'll make one on LD 629. It's currently on the study table. It's a study to look at criminal charges in hospitals and to adjust the task force membership about what to do about dealing with the number of healthcare workers who are subject to attack. It's a $2,250 item on the study table. So my ask is that we move it into the budget.
I second that.
Moved and seconded. Thank you, Senator Craven. Any thoughts about that? Are we ready to vote on 629 and moving it into the budget? All those in favor, please raise your electronic hand. I count 8, 9, 10, 11, 12. Thank you. Are there other amendments to be brought up? Senator, put your hands down, please. Any others to be brought up? Representative Lemelin?
Yeah, I have an amendment that we move Representative Craven back down to a representative if we could.
Did you?
Once a senator, always a senator.
Okay, I don't hear a second for that motion. Moving right along. Are there any other motions to be brought forward related to the supplemental budget? Yes, Representative Stover. I'm not hearing you yet, Representative.
Thank you, Mr. Chair. I would like to move LD 1824 in.
1824 is the 2-year pilot of access to the immigrant legal services as soon as a family comes in contact with Child Protective and the safety assessment is initiated.
I second that.
The vote was 8-5 when we considered that, and the fiscal notice pending, as with so many other bills that we considered late in the cycle. So it's been moved and seconded. Is there any discussion? Yes, Representative Javner.
Thank you, Senator Claxton. I would, excuse me, I apologize. I'm getting very tired. Yes, this will be a divided report. Thank you.
Can't imagine why you're tired, Representative. Thank you. So motion on the floor is to move in, now I've lost it, LD 1824. I don't see any additional discussion. All those in favor of moving in 1824, please put up your electronic hand. I count 8. Please put down your hand. All those who are opposed, please put up your hand. I count 4. Thank you. All right. Any other motions? Yes, Representative Meyer. I'm not hearing you. Representative Meyer, is your hand still up?
It is. Okay. I was on mute. I would like to move LD 393 into the budget.
Second.
That's to expand home builders and parents as teachers. increase the kinship budget, and increase the contingency fund for reunification.
It also adds a position, it also adds a position in the department for coordinating
Coordinator.
of the, yeah. And so
Okay.
we have a fiscal note pending. It was an 8-5 vote. Thank you.
Thank you. Representative Senator Moore.
I was actually going to bring up something else, but I guess my question would be is that I thought the majority of 393 was also included in the supplemental budget already.
Not at the numbers that, go ahead.
Not at the numbers that are, this would increase the appropriation to home builders and parents as teachers.
But I thought that
as well as doing other things, but it would increase that line.
Okay, thank you.
Any other comments, questions? Representative Jabner.
Thank you, Senator Claxton. This will also be a divided report.
Thank you. So any other comments? All those in favor of the motion, please put up your electronic hand. 8, please put it down. All those opposed? I count 5. Senator Baldacci, is your hand up or down on this one? Okay, 8-4 on LD 393. Any other amendments? Representative Zager, is your hand back up?
Yes, Senator, I to propose another amendment.
Please.
I move LD 1841 to reimburse hospitals for the blood spot testing into the budget.
Second.
Okay, this would stipulate that main care reimbursement for hospitals for uncompensated increase in costs for blood spot testing would need to be backfilled at $550,000 when the price of the blood spot doubled and the main care payments didn't. Any discussions about that? This has already been, the basic bill 1841 has been signed already to increase the blood spot, but this is a amendment to backfill the $550,000 for the hospitals. Anna?
I'm sorry, so this is not really the bill. The bill has already happened. This is about the hospitals, correct?
Yeah.
Okay, so it's a separate line. It's not the bill. Got it.
It's tied to that bill, but it's a separate line. Yeah. Any other comments or questions? Guess we're ready to vote then on LD 1841. All those in favor of directing, oh, actually, I'll rephrase that. All those in favor of redirecting Medicaid money to the hospitals to compensate for the lost revenue of $550,000 because of the increase in the blood spot testing, please raise your hands. I'm at 9, 10, 11, 12. Thank you. Thank you, Representative Zager. Okay, any other amendments? Representative Perry, is your hand still up or again?
First of all, a question. Have we added 1748 to the budget yet?
We have not.
Then I would like to add 1748. I don't have a fiscal note, but that's to improve job training, education, opportunities for TANF recipients.
And that was a unanimous vote out of committee. Thank you, Representative Perry. Is there a second?
Second.
Thank you, Representative Craven. So any discussion about that? Representative Madigan, your hand up? Not down. Okay. So that's 1748. All those in favor of moving 1748 into the budget, please raise your hand. $12. Thank you. Any other items or amendment after you put your hands down? You can't all have amendments. Representative Meyer? Nope, hand down. Senator Baldacci? Representative Perry?
Thank you. What I would like to do, and it is a study, is 1729. There's no fiscal note right yet, but this is the study for the possibility of having insulin production in Maine.
Thank you. We don't have the fiscal note because, partly because of the study. It was unanimous out of committee. Anybody with comments or suggestion? All those in favor of supporting a study being done on producing insulin in Maine, please raise your electronic hand. I get to 12. Thank you. All right. That was made by Representative Perry and seconded by. Okay. Any other amendments to come before the committee? Senator Baldacci? Nope. Okay. Senator Moore.
I don't necessarily have an amendment, Senator Claxton, but I have a question wondering if when we were going through the lines, we have several of the lines that were divided reports. And I didn't know if it's possible for us to do minority reports related to some of those divided reports. I didn't know how that works.
So Anna, is that something you can help record for us?
I think so. And Luke, feel free to leap in if I go awry here. So the way that those divided reports are right now are just a vote to move in and not to move in. Okay. If you, and we probably would have brought this up at the end of today, if you have language that you want to include in the memo that comes from you, or you want your own minority amendments, then we would certainly need to know that too.
Okay. So there's some of the lines that we voted, that was a divided report, that our minority report would suggest that the source of funding come from a different source than the general fund.
Okay, so perhaps when we are done, we could revisit some of those, or you could tell us which lines they are if you already know, whichever is the most efficient, Senator.
Okay, well, I do, thank goodness for Luke's document that summarized the one-time COVID payments, because that makes it very easy. So I can tell you right now if this is when you would like to know.
Okay, sure.
Okay, so we had lines 119 and 120. That was a divided report. And what we were proposing is that we utilize, or that the Maine Care Stabilization Fund that has the balance of 54.5 million prior to the 30 million that's going to be transferred from the language thing, that be the source of the funding, the local funding, so that we can get the federal match. So we use that fund as opposed to the general fund. And that will be the same for the additional lines that I'm going to mention. Okay, so the next one then would be the 218 through 224. And the 225 through 229. So that addresses the hospitals, it addresses the nursing facilities and residential care facilities, and it also addresses the long-term care providers. So that we would not lose out on the federal funding, but we would use, instead of the general fund, we would use the Maine Care Stabilization Fund. I know that when we were first expanding Maine Care, that was very important for us to have that fund, but I think we've kind of leveled out at this point, that we don't need to have that large of a fund. Obviously, we were able to return 14.5 back to the Fund for Healthy Maine that we had set up in reserve. So that's the justification behind my minority report.
And what was the third? What was the third instance, Senator Moore?
It was 225 through 230.
Yeah. Okay. Thank you.
Yes, thank you.
And that's for your whole caucus, is that correct? Just
That is
not at me,
correct.
Representative Javner? Okay.
That is correct. And then let me know if you need anything else, Emma. Thank you.
Thank you. Representative Meyer?
Thank you, Mr. Chair. So lines 192 and 193, I would move that we increase the general fund amount by $282,489 to $320,058.
92 and 93 on page 33.
Correct.
And Representative Meyer made a motion. Is there a second?
Second.
Thank you, Representative Perry. Yes, Representative Javner?
Thank you, Senator Claxton. I apologize. Can you just repeat those numbers, please, so that I can write them down? Thank you.
Yep. We would increase the number by $282,489 to $320,058.
All set, Representative Javner?
Yes, thank you. Are we just voting now to reconsider those lines?
We'd probably need to vote to reconsider before we can change them. Yes, thank you. Any other conversation about this? Okay, so I would entertain a motion to reconsider lines 192 to 193.
So moved.
Second.
Okay, so it's been moved and seconded on using the electronic hand. All those in favor of voting to reconsider 192 and 193, please put up your hand. This is the reconsideration vote, and it is 11. I see. Okay. Thank you. Please put your hands down. So the motion has been made and seconded to make the changes in that line 192 and the appropriate changes to follow in line 193. Is there any further discussion? Yes, Representative Javner.
Thank you, Senator Claxton. This was a divided report previously, and it will stay a divided report. Thank you.
Understood and appreciated. Thank you. Okay, so we'll go to the vote. All those in favor of changing line 192 to reflect the amendment offered by Representative Meyer, please put up your hands. I count 6, 7. Senator Baldacci is 8. Thank you. Please put your hands down. And for those who are opposed, please put up your hands. I count 4. Okay. Very good. All right. Are there any other amendments? Senator Moore, is your hand still up, or you want to vote some more? Okay. All right. Are there any other motions to come before the committee before we conclude our consideration of the budget? Well, that was longer than our typical day. Lots of discussion. I appreciate everybody hanging in there. We are done with the green pages, the purple pages, and I still miss the pink pages, but I did pick up mine last week. All right. So right now we're scheduled to reconvene on Wednesday. And that may or may not be in person, depending upon how it's not going to be in person? Okay, it's going to be remote because of the flooding in
No,
across.
the whole week, all the committee meetings are remote.
They're all remote. Okay.
They were already before the flood.
Oh, okay. All right. Very good. Okay.
We can't be in person, they say, until March 21st, and hopefully we're already done in committee.
I'm done. I hope you all too are too. Okay, Representative Zager.
Thank you, Mr. Chair. Just like a very minor technical thing. Earlier, we voted on LD 415, moving that into the budget. And I think in the discussion, it was mentioned as a $2.5 million fiscal note. But I believe that's a 6.5. And I just want to make sure that everyone on the committee intends the appropriation that we voted on.
So let me quick look that up, because my understanding was the 6.5 was what the federal pull down was.
No,
No? Okay.
no.
I think it's 6.6 general and 14 million federal match.
That's what I see on the screen. Okay. So what did I say? Sorry about that. All right. So it's 6.6. Does anybody want to reconsider the moving line 415 in? I'm not seeing any heads up and down, so we'll accept that the chair was in error and has been corrected. So we'll go with that. All right.
Thank you, Representative Lager. Good job.
Any other work to come before the committee? I look at Anna and Sam.
No, but I do just want to say that Sam's working on the memo, which is due on Thursday. And then you have chairs and leads reporting back to appropriations on Friday. I just want to let you know that we may not have every amendment for bills that you have voted in today complete, but we will put in what we have. I'm just letting you know that you won't be looking at a perfect amendment for every bill. Oh, and the other thing I forgot to mention that somebody had asked for the amendments for LD 1960, the Child Welfare Ombudsman, and I sent that out and posted that so you could see it.
Okay. Thank you. All right. That being the case, I want to thank Luke for all of your help getting us through the budget. Always look forward to working with you. You make it manageable, so appreciate your contribution. And to let's give him a hand. There you go, Luke. We're on your team. And I want to thank the department, Director Probert and Finance in the form of Ben Mann and Molly for hanging in there during the consideration. So thank you all for your efforts. So we'll see you Wednesday. Take care all.